ladies and gentlemen. Welcome to the 31st episode of the Indian Academy of Neurology Talks to the Legends. And tonight we have with us Professor Arabinda Mukherjee of Kolkata, a man who needs no introduction, the former president of the Indian Academy, a stalwart in the field of clinical neurology from Eastern India, a teacher par excellence, an energetic organizer of major conferences, and a wonderful ambassador of his field to the rest of the country and the world. Welcome to the talk show, Professor Mukherjee.
Thank you.
Professor Mukherjee, your journey began on the 29th of December 1949 in Kolkata. You were the younger of two siblings born to Dr. Sudhanshu Kumar Mukherjee and Mrs. Sunita Mukherjee. Tell us a little about your parents and how they influenced your younger days.
Thank you, Arindam. Before I go into the depth, I would like to thank you and my very close friend, Dr. Nirmal Surya, now President of Indian Academy, and the IN Digital team for including me in this very prestigious program. So to start with, I was the second sibling, and my father was his late Dr. Sudhanshu Kumar Mukherjee. He was a doctor, and he did his MBBS from Medical College, Calcutta, where I also studied my medicine in the year 1945. So I used to hear from his stories of those days of teaching in medical college, and there were all British teachers and how strict they were in their discipline and teaching procedures. So after graduating, my father became a family physician, and he practiced in an area of South Calcutta. And Arindam, you must be knowing, because your father is also a doctor, that in that generation, there was not that so many specialties. So a doctor used to be a family physician, a family friend, and family guide. And apart from prescribing medicines, they used to do small surgeries in their clinics. And they were looked upon as demigod. And till today, I can tell you, some of the descendants of my father's patients, they look upon me with admiration. So probably that gave me some impetus to go into the medical line, though we had many other choices at that time. My mother, on the other hand, he came from a very erudite family. My maternal grandmother, maternal grandfather, he was then the head of botany in Calcutta University, a very versatile and educated person. My mother was married early, so she didn't have any formal education, but she was very keen in reading, and she mastered the English and Bengali and was very fluent and was an avid reader of these books. So I was blessed with their blessings, to be very brief.
So in other words, from your earliest formative days, there was an atmosphere of education in which you endeavored.
Yes, exactly.
You have gone on to reach the kind of success that you have. Sir, you were a student of the distinguished Mitra Institution of Bhawanipur, where several eminent teachers held sway. What are your memories of school like?
Yeah, I've got a very pleasant memory. I joined Mitra Institution Bhawanipur in the 3rd grade, and I can exactly mention the year I joined Mitra Institution. It was 1957. I was 8 years old at that time. So it was a Bengali medium school, but we had very prominent teachers. And I can quote one of the teachers, Mr. Keshab Chandra Nag, who was an authority in mathematics. And probably you also have read his book. His book is considered to be a holy Bible in mathematics. Apart from that, there were many reputed teachers. So one thing I would like to mention, Arindam, on those days, the teachers were really, they loved their students. I can at least quote one of my teachers. His name was Rajendra Chaudhary, though we lovingly called him Rajan Babu. So he was a bachelor all through, and he had an apartment in Bhawanipur area. Open house. Though he was a teacher in chemistry, he used to teach all the branches of science, and anybody can just walk in and sit there and ask him about the problems, and he would very lovingly solve them. So these dedicated teachers, probably helped me in going through the hurdles of my life. I can tell you one more thing about my school, that about 4 years back, our school completed 100 years of the journey, and a very elaborate function was done, and where all the ex-students were invited. I was also invited, and I was requested to contribute a chapter to the souvenir they brought out. So it was something that I could give back to my school. And here I met Professor APJ Abdul Kalam personally, and who just retired from his presidentship. So I was so amazed by his personality and his dealings. I can tell you one example, that he looked very uncomfortable on the dais. So as soon as he finished his speech, he just came down the dais and sat with the students and started gossiping with them. So this was, amazing to see him face to face and interact with him. This was a very amazing experience for me. And thanks to my school, my institution, for giving me the opportunity.
Well, sir, with the academic record that you've had in your school life, you could have chosen to become almost anything that you aspired for. Why did you choose a medical career?
Thank you, Arindam, for asking me these questions. So, I was from a school where there was a lot of peer pressure to go for engineering, especially. And I also was impressed by them. All my friends were going to engineering colleges. But my father was very keen to get me admitted in medical college. So I fought with my father and ultimately got his consent, and I appeared for the competitive examinations. I was selected for IIT Kharagpur, and I joined there, deposited my fees. And the day before I was supposed to go, I got a call from BE Engineering College, which is also a very famous college in India, I should say. And I got my subject of choice of mechanical engineering. So I joined there and I studied almost 2.5 months in BE College. But Arindam, I will tell you that we had to go for these workshops. And my first workshop is carpentry. And after attending 2 workshops, I thought this is not for me. So I decided I will again pursue my old love. I told my father. He was very adamant and very strict that I cannot change my decision, because he said, once you have chosen your line, you have to follow it. You cannot go on changing. But anyway, with lot of request and the manipulations by my uncles, my mother, he agreed. And I can tell you, look back, I don't know what would have happened if I pursued the engineering course, but I think I did the right thing. When I look back, I think medicine is the line. And I never regret my decision. I love my decision that I'm in the medical field.
Well, all I can say is engineering's loss was medical science's gain. And it's an inspiring message to also all the youngsters of today who shy away from the difficulties that medical life entails, that if you persevere long and hard, the bounties of medical life are immeasurable. Well, sir, medical college, the grand dame of all medical institutions and the first medical college in Asia, is also your alma mater. Just to walk through those hallowed halls and blessed grounds would have been enough to motivate you. Tell us, if you please, a little about your time at medical college.
It will take almost a full day if I want to go through all my memories, but I'll be very brief. I know that we have a limited time. So in those days, between passing the medical or leaving your school and entering the medical college, there was a 1-year gap, and we used to call it a pre-medical studies. So that was from 66 to 67. I was a pre-medical student in Presidency College, which is also a very prestigious college in India. And then when I entered the medical college, I was really awestruck. And those days, I think it still persists. The newcomers are welcomed by their seniors, and
Yes.
Very contrary to ragging, which the others face in engineering colleges. And it was called Freshers Welcome. And they used to take us around all the college buildings, college departments, and showed us what was in future for us. So first we saw the administrative building, the very Victorian style, built in red bricks, with the large grandfather clock on the top and working. It is not showing a wrong time. And then they took us to the lecture theaters and what you used to call grand lecture theaters, GLT. It was really all stuff. There was a huge gallery style sitting, and there was a dais for the lecturer. And I think everybody like me just dreamed of that one day I would stand on the dais giving lecture. And really it was an amazing experience and it will remain in my life as an experience forever.
Well, your association with medical college was longer because after your graduation, you did your MD in general medicine from the same institute as well, wasn't it?
Yes. And during my medical college days, those days the teachers were par excellence. I have to admit that we fall far behind them. So I can mention one or two of them. Professor Shamal Chen, I met him. And he was a towering personality, and he was very British in his approach, and his teaching was excellence. And till date, I remember that I've never seen him coming to college or hospital without attired in a white suit, tie, and polished shoe. I've never seen him coming in a jeans or high shirt or t-shirts. And whoever has mixed with him, he's known everywhere as an excellent teacher, excellent person, towering personality. But maybe those who are not very close to him, they don't know another aspect of his life. He was a very devout person. He was the follower of Ramakrishna Paramahansa, and he could impromptu recite, hours from the Veda, Upanishad, Ramakrishna Kathamrita, Gita, and he would just give examples of maybe I've done a mistake in my clinical study. So you will quote from Gita in Sanskrit that this is what you have done, and that will remain in your mind for long days. I was associated with him from my third grade and till he passed away in 2012. He was a father figure to me, and I really miss him. And there were other many eminent teachers. I cannot name all of them in this short time.
It must have truly been a privilege to have been a student of Professor Shamal Chen. Sir, your medical journey next took you to the School of Tropical Medicine, another distinguished institution which boasts of, among other things, the discovery of urea stibabine by Professor UN Brahmachari, and also the first report cases of histoplasmosis and hemoglobin H disease in India. What brought you to the School of Tropical Medicine?
This was not really my choice. So when I did my MD, I was posted in a suburban hospital. So now I tried to come into the mainstream. And there was a post at that time in West Bengal Health Service, which was called a basic teaching post. So to become a teacher in future, you have to do 3 years basic teaching post. And so I was posted in School of Tropical Medicine as a resident medical officer. It was a 3-year tenure post. I love this institute. It has a lot of heritage. I worked in the same lab. I worked in the same library where all these, doyens of medicine has done it. And so it was a tenure post for 3 years. And here in School of Tropical Medicine, something happened which probably changed my destiny. And if you have time, I can narrate it.
Please do. Please do.
So just to give a brief idea, those days, after 3 years, you will be posted to a district hospital, maybe some town as a specialist physician. And depending on his luck and probably your connections, you may stay there for 8 years to 15 years. So after that, you will come back to one of the medical colleges. At that time, there were only 5 medical colleges, not so many now we have. So as a lecturer, and then you go up the ladder to the professor, etc. But so I was quite prepared for doing that. I completed almost 2 years of my tenure in as RMO. Then on one evening round, I met a person who was an IAS officer, and he was just chatting with me. What is your future plan? I said, I will go to district. But why do you do that? I said, that's the norm. Everybody follows. Well, no, that's not the norm. And my friend's son, he has done further studies. He has done DM in neurology. So I think you were a good student. I have heard from the director that you were a good student. Why don't you do DM neurology? I remember I spent a sleepless night, and and that person later I came to know was none else than Dr. Obijit Chatterjee, and and his father, Dr. R.N. Chatterjee, was a very eminent neurosurgeon, was a very close friend of this IS officer. So after passing a sleepless night, I went to see the director of School of Tropical Medicine. He is a very eminent parasitologist, Professor A.B. Chaudhary, and world famous figure you must have. But he was very strict. So and it was almost unthinkable that a person to the rank of RMO can leave School of Tropical Medicine before completing his tenure. So I gathered a lot of courage, met him in his office, told him. He was quite surprised. And then he said, why you want to do that? I said, I want to pursue studies. Well, why? I said, I will become a teacher earlier. Then he said, are you sure? You will not be from a frying pan to a boiling water? You sure? You go back, think, come back tomorrow. So I again thought over it. Next day I went and he said, sir, I have made up my mind. And he was so kind that he immediately called the writers' building at that time, which was the seat of administration, and called the director of medical education and said, look, Arabinda wants to pursue more studies. Give him a posting. I will release him the day he gets the posting. So that was the total turning point. Something I think this sort of things happen in everyone's life. So probably, I don't know whether it is a destiny or it is luck or it is a chance. So that was the beginning of my journey in the field of neurology.
Well, we in the field of Indian neurology too are very indebted to that fortuitous meeting that you had with the IAS officer that brought you to mainstream neurology. Could you take us, sir, through your early years with neurology?
So I was posted as same resident medical officer in Arjikar Medical College, one of the 5 medical colleges. And then I was there from 79 to 81. In 81, I joined Bangalore Institute of Neurology. And that time it was a combined department with Institute of Postgraduate Medical Education and Research, so-called IPGMER, as the research officer. So my responsibility there was primarily to look after the electrophysiological laboratories. But at that stage, the equipment, the lab service was very basic. Fortunately, the change was coming. New techniques were developing and new machines, equipments came into market. So I had a good opportunity, and my head, our departmental head, was Professor N. Sarangi. He gave me a free hand, and I always remain indebted to him for giving me a free hand to build up the lab. So there I built up the lab. We had up-to-date machineries and good electrophysiological equipments. And it became probably one of the first electrophysiology lab, at least in the eastern region of India. And then I appeared then I entered into DM course in 82. And it was a 2-year course at that time. And 84, I appeared for final examination. Unfortunately, I passed in first attempt. And in this exam, I met my mentor, Professor B.S. Singhal. You know, he was my examiner, external examiner. And the moment I saw him, you know, you were mesmerized by his personality, his attitude, his approach to the patients, his style of speaking. And we developed a affection between each other, which persists until today. really, if you ask me what I would like to be or would have glad to be, there is no other one than Professor B. Singhal.
Well, nearly 40 years since you passed your examination, all of us young neurologists are still inspired by Professor B.S. Singhal. Nothing has changed, gentlemen. So your first chance to learn the art of neurology outside of India came about when you went for a short stint to Newcastle upon Tyne, if I'm not mistaken.
Yeah, it was a year 88 or 89 in between. So we got the new equipments. My departmental and director of the institute, they wanted me to have a hands-on training somewhere in a good center so that I can pursue this. And fortunately, I got a chance to work with Dr. Peter Fawcett. Some of you may have heard his name. He was an electrophysiologist. He was in Newcastle upon Tyne, and it was my first visit abroad. He was an excellent person. He knew I was what I should say, I had very basic knowledge of electrophysiology. So he actually, taught me how to do nerve conduction, how to do EMG. And one special thing that he was pursuing single fiber EMG. Very few people used to do that. He was working with Erik Stolberg of Sweden, and he showed me and probably taught me something about single fiber EMG. And there also I met some of the doyens of neurology, like David Betts, who is still comes to India as visitor, Neil Cartage and others. And on Thursday, we had morning clinical meetings. There I saw how the clinical meetings are conducted. You start with the residents, then the junior consultants, the senior consultants, and then the final verdict from the chairman of the. And we always looked forward to the Thursday meetings. It was just an experience how analytically the British neurologist, approach the cases. I think I have got great regards for British neurologists and Indian neurologists.
And Newcastle is a very beautiful city.
Yes, it was. I was nervous. It was my first stint abroad. I went alone. No one really known person. So I was put up, accommodation was given in a nursing hostel. I got a room. But within a week, I fell in love with that city. It was a nice city, small city on the riverside of Tyne River. And the people there were excellent. They were, and I tell you it was a Thursday and Friday was a holiday. So my teacher, Peter Fawcett, from Wednesday, he started me hammering. Hey, what are you going to do in the weekend? I said, I'll do something. But no, you can't do something. It is a 3-day weekend plan. And he planned every trip for 3 days, go to Durham, go to this castle, he was so, knew that I will be totally, out of place. So these are the little things which you remember. It may be how many years, 11, 30 years over, but I still remember these small things. And I regard him as a great teacher and a great person.
So over the years, you have been great friends with many neurologists. Anyone whose association you particularly cherish?
I cannot name anyone. I have so many friends. But if I have to start, I'll start with my friend, philosopher, guide, whatever you can call him, is Dr. Ambar Chakraborty. He's 2 years senior to me in my college. So he taught me how to examine and how to write papers, how to present papers. And, initially you need some projection to come into in the front field. So he arranged for my talks in the API meetings. I was very junior in the category of API speakers, but he promoted me. And till now, we are very good friends. Actually, we have become family friends. And I have great regards for that person. I worked with him in the Indian Academy of Neurology. I was in the executive committee member for 2 consecutive terms. And in one of my terms coincided with his presidency. So we work together very lovingly. Even till today, we are very good friends, and we chat often For the COVID, we don't see each other, but we have long talks on the telephone. And then I have to mention, though I'm a little sad to mention the name, is Dr. Vijay Chatterjee, who was also colleague of Dr. Amar Chakraborty, but I had great association because we worked together in the same hospitals, and in all our tours he was our tour guide. Excellent person, but we lost him 2 years back early. I have to name many, like Dr. Pahari Ghosh, your father is one of the best friends of me, Dr. S.K. Biswas, and then Dr. Kullan Broto, and though he is much junior, I consider him my friend. And also in the national field, I'm very fortunate to have so many, friends. Just to name a few: Dr. Nirmal Surya, Dr. Gagandeep, Dr. Chandrasekhar Meshram, Dr. Satish Chandra. So all of them, I can tell you, Arindam, that what I enjoy in neurology is the feeling of fraternity. We don't compete with each other. We just want to love each other. And we see that everyone progress and becomes more successful. So this is one of the beauty of neurology or neuromedicine, at least I can say.
You have been great friends with your eldest sister, who sadly passed away untimely. Tell us a little about her and your relation with her.
Okay, he was 2.5 years senior to me, Gauri, and she was her character was totally opposite to me. I was always, very obedient, very submissive, obeying commands, no fighting spirit really in my childhood. But she was fierce. She used to fight for her rights. And even if I have got some, injustice from my parents or seniors, she will fight for me. She was a good student. She did graduation and with honors in Bengali, and she was an excellent singer. She got certification from Rabindra Bharati University for Rabindra Sangeet, and she till her last days she used to recite musics, and unfortunately lost her early. I do miss her.
Well, sad as it is, it's heartening to see the bond still exists. Post-retiring from government service in 1992, you went into private practice, which would have been quite different and must have been a new challenge. How easy or difficult was it to make that transition?
See, it was a complete, jump in the dark, you can say. I had a very stable government service. When I retired from IPGMER, I was assistant professor. But I decided that for some reasons I wouldn't like to divulge here, I decided I leave government service. And I thought it would be, many of my friends said it is a great challenge. You are taking a great risk. But for some luck or my good fortune, I was received with open arms by two very eminent corporate hospitals, namely Calcutta Medical Research Institute, which is now known CK Birla Group of Hospitals, and Kothari Medical Center. And they received me with open arms and gave me all liberty. And I'm very fortunate to work there. And I learned many new things which you never learn while you work in a government service. Here, the culture is totally different. You have no umbrella on your head to protect you. You have to prove your perfection. You have to tackle difficult cases all by yourself, though your assistants are there. And then you have to face the relatives, the patient's questions and queries. And also you have to establish yourself in a field where already there are many established physicians. So you have to do something more than they. So I did that, fortunately, and I got good support from the corporate people. I'm quite lucky in that sense.
You would have, sir, in your career dealt with countless cases which would have perturbed you. Anyone that you would like to share?
Yeah, if you give me 2 minutes, I can share a very challenging case. And it was a story about a girl, 6 years old. And it was in the morning time. I was just getting ready to go to hospital when a very disturbed looking parents, a couple, came up with a child in their lap and said, doctor, this child is not breathing, not moving, she has paralysis, I heard your name. I was totally unknown to them. So I said, immediately go to the hospital, and they rushed to the Kothari Medical Center, got admitted in the intensive care unit. And by the time I reached there, she was intubated and ventilated. So they did, that was within 1 hour. And then I thought initially my impression was it was Guillain-Barré syndrome, respiratory paralysis, she was not moving limbs, so the jugs are present. Okay, give her IV gamma, nothing happened, child is deteriorating. So on the 5th or 6th day, when we are almost desperate, I said, why not try it, hydrophonium? So we gave a trial with hydrophonium, and it was a magic. The vital capacity increased by 3-fold. The child moved her limbs. And then the mother, in retrospect, told that, yes, for the last 1 year, she was looking very tired with droopy eyes, and probably they thought it was a school pressure. And the child, after the treatment, they survived. And I was very happy that when she was 20, maybe after 20 years, she came to invite me for a marriage. So this is my learning, is that when you are in a corner, you are desperate, you try all your armamentarium, whatever. It may be illogical, it may be illogical, but you are playing with your life. So don't hold it back. Let us see. So you try, and if it is not harmful, then you try all your armamentarium. I think this what I learned from this case.
An important lesson indeed, sir. Ever since your earliest days in neurology, you have engaged yourself in organizational work. Could you tell us a little about your journey in this field, so that young neurologists like myself listening to you today?
I had I had a liking for organizing things. Even in my school days, I used to organize the drama competitions, etc. And I made during this time, I met many luminaries like Professor Satyen Basu and Justice Ramaprasad Mukherjee, etc. But coming to neurology field, I think I did start the first Association of Neuroscientists of Eastern India. The first conference, it was known as EZCN, Eastern Zone Congress of Neurology. And I was the founder secretary. And then later I became president. And also I organized successfully, at least the people say so, I shouldn't say, the ECON, the Epilepsy Congress. It was very well attended, and it was through the IronCon in 2017 in Kolkata. And now we are doing a Neuro Summit under the newly formed Kolkata Neurology Association. It is from September 16 to 18. We are having good international faculties with good topics. So I take this platform to invite all our colleagues that please come join us. So I always loved organization. Sometimes it becomes difficult because of the logistics, also because of the not liking amongst your people. So there are certain things, but fortunately I could deal with this. And I remember one thing when Gagandip told me to edit the first book of textbook of neurology. So I said, Gagandip, why me? Why there are so many persons, so many, So Gagandip just told me in one line. He said, sir, you are a person whom, if you request, will be never denied. So you go along well with everybody in the field of Indian Academy. So if you take charge, everybody will be joining you. So I understood, and it was very tough task. We had almost 25 contributors, and we finished the book in 11 months, and it is still considered to be one of the very useful book for particularly young clinicians and the postgraduates. So organizational work I do like. I don't think it is a burden.
Well, that textbook of neurology is an exceptional success story because it looks at neurology from an Indian perspective, something that most of us can relate to. And on behalf of a large body of Indian neurologists, I thank you for your immense contribution to the textbook.
Thank you.
To quote Anthony Brandt, other things may change us, but we start and end with the family. The start to your life was through exceptional parents, but the perpetuation of that exceptional life was through your wife, Professor Arabinda Mukherjee, who's one of Calcutta's most notable pediatricians, and your children, Mrs. Arabinda Shibram and Dr. Vikramjit Mukherjee, both fantastic success stories in their own right. Your thoughts on their contribution to your life?
I was very fortunate. I met Asha in medical college. We are from the same batch. So we were friends, but probably in the final year, we decided to, give a serious thinking. And we had initial hesitation because she is a Jain and I am a Bengali, but those days it was long. But ultimately, we had a marriage, and I'm very indebted to her for her contribution. For my academic work, professional work, I had to be out. I had to travel. I had long hours on my duties, but she managed the home front with bringing up my kids. She's a pediatrician, and a lot of pressure on her also from the professional side, but she managed everything. My mother, I used to love her more than myself. She was very fond to my mother and father. So it was my good fortune. And regarding my children, Vikram is my son. He's now a director of critical care in Bellevue Hospital, which is the attached to New York University Hospital. He's doing quite good. And his wife is Nidhi. She is an endocrinologist in the same hospital. My daughter, Anindita, she is married to Rohan Shibaram. Both are in the accountancy line. Both of them are chartered accountant, and my son-in-law did MBA from Kellogg University in Chicago. So they are in the finance line. I have got two sons from my son's side and two daughters from my daughter's side. And our main charm in looking forward to travel, etc., is to meet them. And my children also blackmail us that, okay, they will call you first time grandparents if you don't come, so you better come. And we spend 2-3 months every year with them. Yeah, that's it.
Equally divided time between them?
Yeah, they calculate by hours, not by days. So many hours, so many minutes. So you love Didi more than me, and all this emotional thing comes up. So we try to make it equal as much as possible.
Well, every successful person requires some time to unwind. What helps you relax? What are your hobbies?
Okay, Arindam, if you call me really hobby, I'm quite lagging in that. But what I love to do are two things. One is that I love to travel. Your father can be a witness to that. We have traveled to almost all corners of the world. We love seeing new countries, new sceneries, mix with new people, taste new food. And we have traveled many places. I'm quite lucky, both India and abroad. And certain places are left behind. I think I will be able to do that.
So what is on your bucket list?
That's Russia, St. Petersburg, South America. I have lost twice. The chance was there. I couldn't go because of some reasons here. So I think I'll be able to do. We have a strong intention of going to these places. Yeah.
Well, I hope to find you in one of those tours.
Music is another thing I like. Particularly, I'm very fond of Tagore's song and Tagore's poetry. So at my age, I think, the Tagore's song and poetry is written in such a way that people will make different meanings of them at the age they are reading it. So when I read it as a young person, a boy, I had a different meaning. When I read it now, I have got a different perspective. So it is something very amazing.
Well, Professor Mukherjee, we are coming to the end of our talk show. But before we end, if you were to share a message with a young neurologist listening to us today and who are inspired by you as you were 4 decades ago by the likes of Professor Shamur Jain or B.S. Singhal, what would that message be?
Yeah, Arindam, I really don't want to preach because I think the present generation doctors, or I should say all the present generation people, they are much more dedicated, devoted, intelligent, and studious than what we were. They are very good at their professions. But if we take my experience, I will sum up in 3 or 4 words. First is love whatever you do. If you don't do it lovingly, you cannot achieve a good outcome. So if you don't love it really, you leave it. So whatever you do. Second, you learn from your mistakes. Never hide your mistakes. I have many mistakes. I think everybody has got mistakes in their life. So if you learn yourselves and discuss with your friends, you are not only helping yourself in learning, but also helping your friends or your colleagues or your juniors for the learning. And what I feel that have a good fraternity feeling, never criticize anybody. Everybody has got some good points, some bad points. And what I think I am the Bible, I may not be so. Maybe the person who is not agreeing with me is correct. So listen to him. And these are some words which I have learned through my long journey in my life.
Those are definitely words of wisdom. Before we end, sir, may I request the IN Digital team to help us go through some photos from your life's journey. Faded as they may be, they are still.
How could you get it? So this was during the World Federation Neurology Congress, which was held in Delhi, probably 80. Which year? You remember?
1989.
Yeah, 89. Yeah, 89. So this was my first international poster presentation, and it was a poster on neurocysticercosis. So I just take this opportunity that I got acquainted with neurocysticercosis during my stay in Bangalore Institute of Neurology. And I published the paper, probably the first from the Eastern region. And maybe for the paper or otherwise, that got invitation from Royal School of Tropical Medicine in Scotland, no, in France. Yeah. So Professor Michael Duma, he was a famous man. He invited me, and he was so impressed. His son was working in Paris in Salpêtrière Hospital. So he asked his son to request me to give a talk there. So this was one of my favorite subject, and I presented this poster in the World Federation of Neurology. This is also very interesting. You can see the very reputed persons. I think all of our generation, and including you, will understand. In the center with the blue jacket is Professor N.H. Wadia. Yeah. And on the left-hand side is no other than C.D. Marsden. This was his first visit to Kolkata. Next to him is Mrs. Marsden. And on the left-hand side is spectacled is myself. And on my side is Dr. Amber Chakraborty. And a glimpse of Mrs. Firoja Wadia we can see from the corner. So this is a very valuable picture. This was a meeting held in Taj Bengal. And then we knew that movement disorder, what movement disorder is really is after Professor Marsden's talk. This is the same as the dinner time. It is myself and Professor Marsden, and you can see in the dinner table, Mrs. Wadia, Professor Rai, Dhamma Chakraborty is standing. He's quite excited. He's standing to say something. And in the middle, my father figure, I should call him, Professor Shamul Sen. This was somewhere in Ranchi, on the Anikon conference. On the left-hand side is Professor Trishit Roy, and on the right it is myself. It's probably many, many years back. This is my daughter. It's taken in my home. It's a little old picture. She denied to allow me to give this picture. Says this, I'm much younger. I said, I want you to be younger also. And my daughter with myself. And this is one of the meetings we organized during my very early career in BIN. And the extreme left is myself, followed by Professor P.K. Basu, followed by Justice Chittutosh Mukherjee. And on the extreme right is very eminent, and he's no more now, Professor S.P. Khatua, who was a pediatrician. Okay, this is with my mother, myself, Asha, and Anindita, my daughter. This is quite a recent one. We can see my son, Vikramjit, harassed with two, I should say, little ones. One is standing, he is the elder son, his name is Rayan, and one in the lap is Shuvi. Both are very naughty. And on the right-hand side is Nidhi, his wife. On the left is Asha, and extreme left is myself. This was taken in New York in my last visit. So this is one of my tours. I wanted to include this picture. This was probably in Kashmir. And then too, we are so relaxed, so calming, you know, it gives us, gives you extra oxygen. It's one of the recent talks where I was just discussing on epilepsy. This is a Calcutta scenario. And I was giving a talk on, I think, refractory seizures. This is with my wife, Asha. This is in Hyderabad, Nizam's Palace. And we had a splendid time. This was just before COVID. I think COVID started in 2019. 19, is it?
Yes.
And it is almost 2 months. I think this was our last visit pre-COVID. Thank you, Arindam. Thank you.
Well, some of those photographs may be faded, but I'm sure they're as fresh in your mind as if taken only yesterday. Sir, it has been a real privilege to walk down memory lane with you. It is my honor to bring to the larger neurology fraternity of this country someone whom I have had the utmost respect for and whom I have been inspired by for the better part of 3.5 decades. I thank you for your time and for your patience.
Thank you, Arindam. Thank you, the IN Digital team, and special thanks to Nirmal and for including me. I love this. Maybe I became emotional a little bit. Yeah, going down the memory line always makes you emotional. And I look forward to more growth of the Indian Academy of Neurology. As it is doing very good. And I think it will progress further. Thank you.
Well, thank you, ladies and gentlemen. That was a chance to see the man behind the legend, Professor Arabinda Mukherjee. From all of us here at the Indian Academy of Neurology, thank you very much. Have a great evening. Good night.
Thank you.